I would like to call Professor Radhey Shyam, Dean Faculty of Behaviour and Cognitive Science, CBLU Bhiwani, Haryana.
It relates to how the psychologists have come out during this pandemic COVID-19 and what precautions they should have taken, or what kind of you can say handling of the cases they are getting at the online counseling and otherwise also. So I have a few you can say observations, and I may be sometime very critical also. So this is my, if I can share, I do not know how to share the presentation here. Critical crisis, pandemic and war-like situation or wars. Wars, pandemics and crisis do no benefit to anyone. We all know that. But this is fortunate or unfortunately, the psychology had got benefit out of the two big wars, two world wars. All the students of psychology knew that maximum development of the profession of clinical psychology took place during the two world wars. And it was after Second World War that psychologists in the United States, they focused, they organized. The first training module came out of after that in 1949. The AP accepted the Boulder model, the scientist scholar professional model at the place known as Boulder in Colorado states. Then certain kind of ethical guidelines came in 1953 first time, and then these are revised from time to time. We all know that. The professional regulations were also established. So that is the test. When the First World War began, the psychologists working in the laboratory, they were asked to come out, help the defense forces in the recruitment process. They were scared, but once they came in, they became confident, they got experience, and many of them did not return back to their laboratories, as they enjoyed the application of psychological knowledge which was generated in the laboratories. And in the Second World War, the situation became more, you can say, kind of, the psychologists were more prepared, more ready for such kind of work, and that also gave confidence. So that is how it helped in the development of clinical psychology particularly, and the psychological testing, psychometrics. If you go into the detail, the history of clinical psychology, history of psychological testing, you will find that host of tests were developed during this situation. Now, coming to the current problem, the COVID-19, I think it was in March, around 20th, 18th or 25th, I think lockdown was announced, declared. And it was a kind of, you can say, serious problem. It is still serious, but once the lockdown was announced, we were locked into our houses, and many of the universities and NGOs and other organizations started their helpline, 24-hour helpline, or 9 to 5 helplines were started. I was part of such helplines of 3 universities, the Gurugram University, Gurgaon, MD University, Rohtak, where I was a professor of psychology. I retired in March 2019 there. And then currently I am working with Chaudhry Bansilal University, Bhiwani. So all the 3 universities helpline, I was there. Some kind of cases were there initially, but later on the number dropped down. Number was dropped down. There were reactions, anxiety was there, of course, there is no denying. So now what I'm trying to convey is that the present pandemic situation brought the psychologist at the forefront. You can see how many webinars, seminars, and the helplines were there, and day and night, the psychology students, psychology teachers, those I saw some of them that those who do not have even their specialization in counseling, clinical psychology. They were industrial psychologists working in organizational psychology, social psychologists or something. Irrespective of their specialization, everybody was involved in that. So that I am trying to convey, that the situation became very lucid and very, you can say, alluring for the psychologist, that it has highlighted the role of psychologist, role of counseling, role of clinical psychology in the handling of the crisis situation, in mitigating, managing and treatment of the psychological problems. That is, you can say, unfortunate. I use the word that pandemics and wars are unfortunate, but psychology has gained out of them. Now we all know that psychologists have come at the center stage during this period. Now there is one case a few days back, I think 4 or 5 days back, a young boy of a washerman in adjoining to my locality where I am living. That boy got infected and he was found COVID positive, and his parents and the neighbors, they reacted sharply, and there was a kind of, you can say, uh, trauma, that something traumatic has happened and the situation is out of hand and nothing can be done. At the same time, when the civil hospital or civil surgeon office, they found someone positive, an ambulance goes there to their residence and they ask the you can say affected person to come back, either whether he or she wants to be quarantined at home or want to be hospitalized. Their parents were reacting sharply and they were weeping badly. The boy became very scared, and that anxiety and the kind of trauma and scary situation became more aggravated, and 2 days later the boy died. This is something very serious, and I am highlighting this case that it reminds me that pre and post type of counseling which is being done at the time of HIV testing, here also in certain cases it is required and it can save life. That is why I am mentioning this case here. So the pre-counseling and post-counseling, and that will help the client to gain courage, confidence to face, and that is required here. But now I'm turning towards a different situation. At the same time, we have to be very careful in conducting our surveys, research. You will find that all of you must have filled in number of survey questions. Not one. The one comes, then second comes, then third comes, online surveys. So that you have seen. The way we have to conduct the scientific inquiry should not be compromised with methodology. That is what I am trying to emphasize. So we have to plan. Just before me, Komal was talking about research, and some researchers were asking questions about, some youngsters were asking questions about the research. So what is required, that what kind of question you have formulated, why you have formulated those questions, what kind of methodology you are going to use, the kind of sample and sampling technique, and then the analysis, and finally the drawing of inferences, and most important is the reporting of the results to the masses and to the researcher or to the general public. That is very, very important. We should not compromise these techniques and remain within the realm of the, you can say, what the data, what your present work is permitting you. You have to make your generalizations and predictions only to the extent which are being allowed. Now what is happening, that you open your television sets at any time. Last 1 month I have stopped, you can say, switching on my television. Why? Because there are only two news in most of the TV channels, Sushant Singh Rajput and Kangana Ranaut. Is there no other problem in India? What you are talking about, these two peoples, has any other person is not. I am not saying that should not have been happened. I am not against Kangana, not against something Rajput, but Is that so important that lakhs of people are unemployed, jobs are lost, and everything? You are talking about the COVID anxiety and so many other things. Nobody is talking about these things. Why? That is the question, that they are interested in TRP. Either they call two pujaris, two mullahs, and they fight each other, and then they increase the TRP. So what kind of things they are doing? I just highlight these things because I am bringing the issue back to psychology. Now, I have also seen that in psychology also, people are conduct survey, they ignore the methodology. The methodology is questionable, the sampling is questionable, the data is meager, size of the sample is meager, and they come out with broad bombardment of generalizations, predictions they are making. So they don't even think of whether these are allowed, the data and the results are allowing these things or not. Now let me talk about one survey which I found in Times of India, and the paper is with me. I also prepared the slide, but unfortunately I am not that techno savvy. This survey, the title of the survey, "Every Second Indian Hit by Corona Anxiety," says a study. I am repeating, Times of India. This newspaper is in my hand. This is, I think, uh, it is September 16, Gurgaon edition. "Every second Indian is hit by corona anxiety," says a study. Now the next title is "One in every 4 person may require medical intervention." One in every 4 person require medical intervention. This is the title, and this is the kind of falsification of the results of the surveys. I am saying with conviction that this is something we need not do like that. The sample size of this survey is 1069. The 54% of the sample, the researcher says that the sample was 54% of the sample was from Delhi. Now, you can say they report that 11% from Haryana, 19% belong to Maharashtra, Punjab, Rajasthan. This was the composition of the sun. Then they are saying that every second Indian is hit by corona anxiety. Do you think that this kind of sample permit this kind of generalization and this kind of broad inferences? This I do not support this one. Now they say that every 4%, out of the 4, one is in need of, means 25%. Do you believe this, that corona anxiety in, I am going to my university by driving 60 kilometers daily, and I find that the business is as usual, normal there. Yes, I also know that people are affected, number of 100 or plus something, 100 plus cases are coming to Rohtak daily. But people are not afraid of, no sign of anxiety is there. It doesn't mean that they are not aware of, they are ignorant, but they know that this is something which is there and it has to play its role. What we can do, take certain precautions. That is what is required. So 24% anxiety and stress. If you go by the data, if you go by that only generalized anxiety or anxiety related problems in mental health, if you see the prevalence and incidence of the mental health problems, you will find that around 25% only anxiety ridden cases are there. So where does this corona anxiety is leading to 21 in 4? 1 in 4 is already there. You take any epidemiological study of the major epidemiological study, you will find that more than 25% cases require treatment. So why to give the title that corona anxiety leads to this one and every second? So this troubles me, that the methodology is not sound, the sample size inadequate, and despite those things, the results, the data does not permit us to do this kind of generalization. So that is one aspect. And here I now turn again to another thing. You will find another, so many surveys published in newspapers, TVs, or even internet. Open the net, you will find so many things. I do not say that do not go in for conducting research. My point is simply be aware of these things. If we go like this, we are doing much more harm to the profession than benefit to our own profession. Because then people ignore that what you say, everybody knows this. If you give your key things to the masses, people will all start ignoring you. I am reminding of the fact that in after World War I, there was a craze in United States that people get their children tested for intelligence. It became a fad at that time, and after 4 years, things were again turned away. They found that those who were the psychologists were claiming that this boy is having 120 IQ, is going to become a big scientist or something, great personality, and the boy became a pickpocketer or something, that destructive delinquent or something like that. So then come the time that the people started talking about that no, it is not the general intelligence, rather it is something else which is important for success in life. That then they started talking about aptitude, interest, and so many aptitude, interest test, and personality test then came out. So that is there. What I am trying to convey, that what is the need? The need is that we have to be careful in conducting and reporting these findings. And again, another thing is that we have to take care of taking our profession to new heights. That is the requirement, and that we can do only by uniting ourselves, only by making serious efforts, by, you can say, professional kind of regulations. If it is not legally available, then we can, psychology associations can do these things. They can put certain restrictions, ethical guidelines or regulatory mechanisms can be drawn. Unless now in India there is no regulatory mechanism, only one thing, that RCI is looking after these things, and where you can see that where the counselors are put in, where the clinical psychologists are clubbed, and that scene you can better think of, and you can. So what is requirement is that professional training, by balancing rigors of scientific inquiry and professionalism, that is practice. We have to balance these things. We have to go in for planning our curriculum like that. We have certain internships or skill, that wherein counseling and clinical skills, the interviewing skills, listening skills, or certain kind of practice by going in for making provision for certain internship is there. But first we have to train our students in rigorous scientific ways, or the methodology, or that in other words I can put that some scientific training, or they should be trained first as psychologists, then only they can be appliers of the knowledge. This can be done by professional regulations, professional ethics, and all these things. That is the requirement. Now let me share one more thing, that I don't know how many of you know that government of the Indian government introduced a bill in 2018, which was in focus, and much talk was there about that, allied healthcare profession bill. It was introduced in Lok Sabha in 2018, and the government now has withdrawn this bill on 15th of September this month. This bill has been withdrawn. Now at the same time, on the same day, a new bill is introduced, and the name of that bill is National Commission for Allied and Healthcare Profession Bill. National Commission for Allied and Healthcare Profession Bill 2020. Now this is in, we hope that it may be passed in the current session or in the next session. And as the business goes in Parliament these days, the bill, every likelihood is there that it will be passed in this session only. Now, why I'm mentioning this? The earlier bill proposed something different, and now this bill is proposing and clubbing psychologists, the professionals, you psychologists, we psychologists, barring clinical psychologists, accepting clinical psychologists. This bill clubs psychologists with environment protection officer and ecologist. You are being clubbed with environment protection officer and ecologist together. Now, The another thing is that even the occupational therapist and the physiotherapist have got their identity and independent space. Why I am reporting this? My essence is that, essence of my observation is that we have to be very careful in our training, very careful in our practice, in our professional skills, and then we have to get united and get united and take our due. Due means that you have to create your own identity and independent space. Only then our profession can grow. Otherwise, we will be in similar situation where we are now. So that is what I wanted to share with you all. Thank you very much. That's it. Thanks. If you have any question, any one of you can come and ask. Thank you very much.
Thank you, sir. I would like to request audience if they have any question.
No question.
I think, sir, we are out of words. By your dynamic words, we are imprinted with those words in our mind, and it's very thought-provoking for all the junior and seniors in our field. And you once again proved that united we stand, divided we fall. Thank you so much, sir, for these thought-provoking dynamic words.